Hi, my name is Jeffrey Butts, and I'm a doctor of dental surgery, and I own Camp Creek Dental in Atlanta, Georgia. And welcome back to our horror story series. Okay? Tupac and I just wanted to tell you something. All right? We wanted to speak to you, specifically to you. Okay? I do implants. I do what's called arch dentistry. So basically, if a person has a completely failing dentition due to trauma, due to really bad cavities, or periodontal disease, chronic periodontal disease, meaning the teeth are kind of moving in the mouth, or the pockets in between the teeth and the gums is like 11 or 12 millimeters long. Those particular teeth are very hard to save, and when it's a combination of few teeth or a lot of bad teeth, and if we just took out the bad teeth, we'd have 2 or 3 teeth left in the mouth, well, that's when we consider doing an implant or an arch, meaning we take out the teeth, we put in implants, and then we give teeth immediately that are held on to the implants. Well, when I first got my robot, it was definitely a challenge. It was one of those surgeries where I had an anesthesiologist, I had the robot people, I had my implant company, because this is early, we're using this Yomi robot, which we call Rosie, right? And well, we had a patient that we had put to sleep. He did have a previous drug problem, and it was very, very difficult. The anesthesiologist was finding it was very hard for him to get down. He just wasn't getting down, right? Now, not getting down is bad, because although you go to sleep and I still get you numb and you're nice and numb and you feel pressure, you shouldn't feel any pain. This guy was moving a lot. He was making my robot, because the robot actually attaches to the person in a way that we do it. He was shaking his head and jerking around for no reason. No reason. Well, no reason that we could figure out, okay? His relative was in the lobby, and my practice manager went out because the guy was yelling every now and again. And it seemed like we were torturing him, but he would start yelling and nothing was happening. So that's where we're like, okay, well, maybe it's not us, maybe it's him. But in that type of situation, when you want to care for your patients, any dentist, every dentist does not want to hurt anyone. We know that we got to get you numb, and we got to get you through to a part which may be uncomfortable, but we're looking for an A to Z reaction, that we start it, we finish it, and the finish is good. Well, this guy's yelling was making us feel like we were hurting him, and then we realized when we weren't touching him and he was yelling, that's okay. The practice manager was out there. She was like, oh, we're so sorry about that. Are you okay? He goes, oh, yeah. He screams like that all the time. What? He screams like that all the time? Yes, I'll be on one side of the house, and I'll be woken up by screams in the middle of the night, and he realizes that it's just that relative screaming in the middle of the night, because that's what he does. He has night terrors. Okay, great. Well, that was helpful to know afterwards, but we have done the holes and we're ready to now place the implant in, and I had the implant ready to place, and my patient screamed out the biggest scream that I'd heard, and he jumped straight up, and the implant punched him in his cheek. I couldn't even figure out how to stop that, because he literally rose up and punched himself in the cheek and then fell back down. Implant was still on the part to put the implant in, but it was scary, okay? That particular surgery took 9 hours. 9 hours. Well, maybe there's some reasons we were young in it, using the robot. Certainly he was a difficult patient because the anesthesiologist seemed to be like no help almost. Like, I was like, is he asleep yet? Is this what sleep looks like for him? Yes, it was what sleep looks like for him. He was a night terrors person. And once we realized that, or once the word got back to me that that's how he was, which was never indicated, it went a lot better. We were able to work through the screams knowing that we weren't hurting him, but the screaming continued. And by the way, the patient had no recollection of what was going on at all. He thought we did a great job. He looks amazing. He's smiling. He even said, someone said to him that he had a beautiful smile, and he said that no one's ever said that to him before. So that was nice, all right? I was super happy that he was okay, and we were okay, and we were able to place everything. And that's the horror story. That's a horror story, not for him, for me, all right? Anyway, stay tuned for some more horror stories.